do you measure the safe part of it? Is it that before I start a particular kind of exercise, I need to speak with the doctor, or I need to go for a medical check to know which one will suit, you know, my kind of person or my kind of body?
Yeah, ideally, that's what should happen before you start any exercise, because you should actually, once somebody is of age of taking decision by himself to go to see doctors, you should have a personal physician that you go to consult, and apart from when you are ill, even when you are not ill, for routine checkup. And such will also entail discussing what can you do to maintain wellness or prevent illness. That would then be there. But however, it's not all medical practitioners can actually advise appropriately and correctly. You must be a well-trained person in this line.
In which line?
In
orthopedic?
in the line of exercise that is well.
Okay.
Because
fitness experts.
And it cannot just be one cap fits all. But every well-trained practitioner should know where he can maintain the safe limit. As an orthopedic surgeon who is qualified, who is trained in the bone, joint, and muscle conditions, I should be able to advise on exercise that will be appropriate and safe for this system. But I might not be able to advise one that will be good for the heart in entirety. You get what I'm trying to say? So the cardiologist will now need to come in that angle. However, that's why I say that is an ideal thing to come. But at least the other thing to come in is that just as we have this opportunity, every opportunity to source the correct info, because is tapped and preserved and treasured heavily. Stuff that I've just mentioned now, that once we have stopped growing, and we are not regular sports person or athletes, jogging, running is not a safe exercise for us, for the musculoskeletal system, the muscle, skeletal, and joints. Because apart from this one we're talking about in the backbone, that force, the loading weight that is passing through the central part of the body, we call piling or axial loading pressure. It's not safe. We're no longer equipped. Our flesh, yes, we're no longer equipped to deal with it.
Okay, it would seem as if you're describing more of the chronic kind of, factors that can bring about back pain. I've heard of cases where someone tried to lift
something up,
an object, a heavy object, and that was it.
Yeah, permit me to make a mention here. Again, some of the issues that affect us is also how much we know or apply information we get or source. Chronic, whenever it's used, a lot of times population use chronic as when it's severe. But chronic is when it's long-standing. We needed to share it, because when we see our clients, they bring that on, and if we do not check back to be sure what the person is calling chronic, we might start treating the person as if he has chronic pain, whereas it just meant a very severe pain. So chronic, for those who have benefit of listening to us, is when it's lasting a long time. Then that you describe is actually, remember I said that how those trauma will come or injury will come to that lower part of the backbone is either we're bending forward, or we're twisting, or we're causing pressure passing through it centrally. When we bend down to lift something and we are not squatting to do it the way weightlifters do, we have these forces combined together. So instead of coming in bits or to come over time, it will come a one-off complete snap, and the structure, the backbone, some supportive structures, especially the flesh, the ligaments, or the disc, will give way and be in a position where it shouldn't be.
So that's what could also cause disc slip, or is that?
Is called slip disc, but it was wrongly called slip disc, because to slip means that just our slippers. It will move, one surface will move on top of the other. It doesn't move on top of the other. Instead, it bulges. I don't know if you are seeing my face well, but imagine my cheek doing this.
Okay, bulging out from one side. Okay.
Yeah, that is what a bulge is. So it is actually this prolapse, this bulge. So instead of slip. So
when it bulges, then that pain can come.
Sure, when it bulges, the flesh, the tough flesh around the ligament, the wire we call nerve that is coming from the spinal cord, going to give messages or take messages from different parts of the body, will start suffering pressure from that bulge. And apart from pressure from that bulge, the body also, because there's a break, will begin to throw reaction.
Doctor, I said we'll talk about prevention because it is very, very key, and management. So I don't know which one you want to take first.
Let's start from
the management.
Management,
okay.
If you think.
Because there's a lot of talks around, okay, if you have back pain,
do this,
drink this, and then, you know, that you'll be fine. And, you know, everybody's got their different views as to how this can be taken care of.
It's just a pity. And being something that one of the burdens of this condition is not only that biological pain or discomfort, but psychosocial aspect, because not every young person, young adult, would like to easily share that he has got back pain. So even dying in silence is also part of it. So sometimes, it makes some.
Why not share that you have back pain?
No, don't use yourself to assess myself. Okay. You might be better thinking than myself. I might choose not to confine my illness. Just environment. You know, you have to believe that in this environment, being ill is still like a taboo. It's like you're unlucky to be ill. Instead of feeling that being ill is human, it's only inhuman things cannot be ill.
Okay.
Anyway, so one of the important aspects of the treatment, how to manage it, is understanding what is going on. So that's why I was just trapped about between which one to do first, because the discussion about what is the problem, what is the cause, what is going on. This is one of the situations where what should be done whenever we see, whenever we are consulting a healthcare professional, is very, very emphatic that we must be sure that we know what is, from the practitioner, we know what is the problem, what is to be done to resolve the problem, and what is expected of the client to be able to make sure that the set goal is achieved. So this actually entails education on in entirety what is involved. And maybe before this education...
Sorry, Doctor, just before you continue, I think we have Austin from Iyanokwaja. Hello, Austin.
Hello, Yami. Good afternoon.
Nice to have you on the show. Please go ahead with your question or comment.
Yes, good afternoon, Doc. I have also experienced this back pain on several occasions. And it usually happens when I heavy items, you know, and I went to see my doctor. He advised me to use, he prescribed some medications for me, but the medications are having reactions on my stomach, especially when I take them. So I don't know if you can help us prescribe some medications that one can use to ease.
I'm sure the doctor is not going to prescribe here. Okay, Austin, let's hear from the doctor.
Okay, well, what is important there, you just mentioned it. Perhaps this will easily push me to us to go to prevention, because truly, all the things we do in treatment, all the things we do in treatment, which are using medications or other things, they actually will be to handle the immediate circumstance where the pain is disturbing or worrisome, but to make sure that the result that is gotten is stabilized and prevent recurrence, or even prevent it from occurring. If any person is sitting there and it hasn't occurred, I think maybe we should go through things that should help to prevent that, because that is more important than what is waiting for prescription that we will give. Because it starts from just daily activities, avoiding every situation that will force us, that will make us to bend forward or twist or apply that centrally transmitting pressure through the backbone.
But some people's work, occupation would demand that they bend. You know, what can those people do?
I'll give you an example. Those that do shows, those that do housekeepers in hotels or in some places. Yeah, it's to adopt. It's not that your health first before this job. Adopting adaptive positions is more important. Dressing
adaptive
bed.
Positions.
Yes, because and very productive. When you go to dress the bed, you must not bend forward. Squatting around the bed helps to dress this bed.
Instead of bending.
Okay.